Very good evening, friends. Meeting again in the session of philosophy, and today we are going to start with fourth year's philosophy, Robert's philosophy. There are chapters. One must know that first two chapters from Robert's philosophy, and thereafter directly the chapter number 22 onwards to 33 and last 35 chapters. These are there in the syllabus of fourth year regarding the Robert's philosophy. The first introductory chapter was added in the fourth year syllabus because in fact he wants to explain, and the importance of it is definitely there for the young budding homeopaths, and that's why this chapter is not included for the first year but it is included for the fourth year. And that's why he has started this book with a very specific name of it: what has homeopathy to offer to a young man. What homeopathy offers to an young man. A chapter has very typical name because everyone looks towards the homeopathy with this angle. What homeopathy will give me? What homeopathy will offer me? This is the thought in everyone's mind. Generally, the students of homeopathy, they turn towards homeopathy because they have not got admission to the MBBS, not got admission to BDS, BMS, and then they comes for the homeopathic study. And then, as a last chance to become a doctor, they take the admission to the VIHMC course. And their thought is not to practice homeopathy, but their thought is to practice allopathy. And the question is always there in their mind that what homeopathy will give me, how much amount or money homeopathy will offer me. All those such thoughts are there. Sorry. And that's for that purpose Robert has written this chapter, and very thoroughly he has taken into consideration all points regarding it. And he starts the chapter like this. So, chapter number 1 from Robert's philosophy: what has homeopathy to offer the young man? What has homeopathy to offer the young man as a future? This question comes to us repeatedly, and in our changing economic conditions, it is the pertinent question. Everyone is looking towards the profession, that what this profession will going to give me. This is the thought with everyone's mind. Perhaps we can get at the problem best by asking the young man the counter question: what do you want to get out of life? See, very clearly Robert has put directly, if someone asks you this question, then you must put a counter question to him: what do you expect from your life? This is very important question because people never thinks what they want from the life. There is always one thought that they come for the learning only in order to achieve money. Only this, his honest reply to the question can throw any light upon his adaptability to homeopathy, and only upon the honest consideration of his adaptability can we prophesy what homeopathy has to offer to him. Why is he thinking of studying the medicine? This is the question. So see, this is the one question you have to put to the fellow who is asking you what homeopathy will offer to him. That what you want out of your life. And second important question which he puts over there: why is he thinking of taking the medicine or learning the medicine? These are very essential questions. There are many answers to him according to every individual student. So, what he says further: is he lazy and does he consider a profession an easy way to learn the living? So, there might be one personality who considers that this is a simple profession and it will give him money, and he is lazy. That's why he wants to come for this. Does he look upon medicine as a profession to be sought because of its honorable place in the community, or as a position to be desired to secure in standing in society? Second thought in people's mind is that this has its own position. Being a doctor in front of name gives a value for that purpose, whether he is coming for the learning. Third question, has he an ambition to be held as a great surgeon or bacteriologist? Whether he wants to become a great surgeon or bacteriologist? Is he thinking first of possible financial returns? So this is the commonest thought in people's mind, that this profession gives more money, more financial security. So all those questions, if there are in their mind, then what Robert says is very important. If he would use his foothold as a physician for a life of a case, for a position in the community or in a society, or for a mean of obtaining fame or wealth, homeopathy offers him little that he would care to accept. What he says, if your answer is yes to all the questions above raised questions, and if it is there in your mind, he says homeopathy will offer little to you. He directly starts with chapter with a exactly opposite thought, because people expect something and you say homeopathy offers very little. How does he react to the fads of the day? Fads means different methods, paddhati. How does he react to the fads of the day, the bulletins of laboratories, the spacious advertising of pharmaceutical houses, the glib talk of salesmen? So there are different ways of advertising nowadays in the medical field. How do they start their practice? By putting a very big hospital, by putting very big boards, by advertising on a big channel like this. Does he believe that colloids are, after all, homeopathic potentiation? Or is he convinced that colloidal preparations are but recent and crude imitations of homeopathic potentiation, which are inferior and far more uncertain in their effects than the proven homeopathic remedy? So he puts many questions. These are the questions which arises in people's mind. What do they think about homeopathy and what do they find it out in the homeopathy? If he replies to your questions of his idea of the direction of his future, so that it leads you to think that he looks upon Sikh humanity as suffering men or women, that he has a burning desire to serve them, to help them to better health and therefore greater usefulness and happiness, then you may be sure there is a sound foundation upon which he may build a plan of life in which homeopathy will offer him a great reward. So those people who want to serve the humanity, suffering humanity, there is a great desire to serve the people who are suffering from many disorders. There is a great desire to maintain the health of the peoples with the help of homeopathy or with the help of advertisement. If he is gaining happiness out of all those things, then homeopathy offers a lot to this young man. This is what he says over there. So very clearly he explains about the things. We can proceed further with our probing of his character and abilities and determine what homeopathy has to offer him by finding out what he has to offer to the homeopathy. So he puts the counter question over there. If such a character is there with that homeopath, a budding homeopath, that he wants to serve the suffering humanity, he wants to serve those people who are in need, and his character is good enough, then the question arises that instead of what homeopathy offers to him, better is always question what he has to offer to the homeopathy. There are a number of things on which one can work in homeopathy, and there are a number of places are there in homeopathic field where research can be done. But only thing, it should be there in your mind. Then there are a number of opportunities which are necessary for a young man to offer to the homeopathy. One of the first essentials, now that we are convinced of his unselfish desire to serve, is to determine whether he has stability. If he is mercurial in temperament, easily influenced, and finds it difficult to hold straight course, always seeking an easiest way, do not encourage him to study the homeopathy. What he is saying? He is saying, first important thing, now that we are convinced of his unselfish desire to serve, these criteria should be there. Unselfish desire to serve the people, to serve the suffering mankind, then he is the right person to take the homeopathy. Or if he is stable-minded person, he will not going to change his mind thoughts up and on, then he is the right person who can take the course of homeopathy. But the second point which he highlights over there, if he has a mercurial temperament, mercurial temperament is nothing but the changeable temperament. Sometimes he is too excited, sometimes he is too depressed, sometimes he wants to go for it, sometimes he never wants to go for it. There is a lot of changes in his mind is there. He is not the right person to choose the homeopathy. So see, every point he has elaborated in the to start with the philosophy, and then he says homeopathy is founded upon the principles that are in turn founded upon natural laws. If homeopathy is founded upon natural laws, it is as basic and as eternal as hills. More natural laws were formulated before hills came into being. If man follows where homeopathy leads, he must be able to follow these laws and to hold close to them regardless of the pressure of the influence. So there it is the only science in which there are fundamental principles. There are 7 cardinal principles and which are never changing. Homeopathy was discovered by Hahnemann in 1796 and till today the fundamental laws remains to be the same. They are not changed because they are fundamental, they are natural, and that's why they are called as nature's laws. And when they are nature's laws, they are eternal, they are fixed, they are rigid, there is no question of changing. Then if you if you have eager to learn these laws and follows these laws, there is no question that homeopathy will going to offer many things to you. There is no question of taking the opinion of others. Only thing is that to study the homeopathy in detail. Then he gives certain characteristics or characters the homeopath should born or homeopath should have. The first character which he explains, stability of character must have with it an equal measure the quality of patience. One by one, you just write over there number one quality, number one stability, number two quality of patience. That is the second point. What is stability? Stability is that where when stability comes when you are damn sure about the things. When you learn anything strongly, properly, thoroughly, you are confident about all of it, then you are stable. There is no, there are no two thoughts which develops in your mind. Absolutely no. You are quite confirmed about the things when you have learned the things clearly. Stability always develops from learning hard. If that stability is there, then definitely you go for homeopathy. And second important quality which he mentions over there is quality of patience. Patience is too much needed. There are many times it happens that the homeopaths who practice homeopathy, they themselves never have a patience. How can their patients have a patience? They goes on changing remedy every up and on, every moment. They are not damn sure about it. They are not confirmed about it. If it is lacking, he is not right candidate to go for homeopathic practice. You should be very firm with your thoughts, and then you should ask the patient, yes, it will take two days, it will take 3 days to recover, and patient will recover. You must give confidence to the patient, but that develops only if you have the patience. If you don't have a patience, it never happens. In in ordinary medicine, the quality of patience seemingly is not so necessary. Since we too frequently find that in extreme cases where things have taken an undesirable course, physician comforts himself that everything possible has been done for the patient. Ordinary practice means allopathic practice. What is there is no question of patience comes. These people, they are not so patient. These people practices and they tries one by one. There is many times gunshot therapy which is followed. If you see the prescription of them, even just patient comes with a fever, they gives one antibiotic, one antimalarial, one anti-allergic, one then one antacid, then one antipyretic. All those things, all those mixtures, at least one will work over there. Because they don't have a patient. They are not confident that yes, this is only a viral infection, no need to give the medicine, just wait, give the placebo or wait for but people never do that because they are in hurry. And because of them, patients are in hurry. Because of them, the patients also become impatient. They never want to wait. But with homeopathy, when you have to practice homeopathy, if you are impatient, you cannot. This is the last sentence which they used to explain over there many times. That I have done everything possible, but nothing worked. We have done everything for the patient and nothing worked. This is the thought, this is the answer when their patient is going towards a wrong way. They explain, this is the sentence with which they explain. Everything possible has been done for the patient. In homeopathy, one of our greatest axiom is there. When in doubt, don't. I underline this axiom. What it means? It means if you are not sure about it, tell it frankly to the patient that I cannot handle the case. You should not go on trying, go something. There should not be question of trial and errors. So one should not go for trial and errors. One should be either confident, yes, to prescribe or not to prescribe, to take the case in hand or not refuse it. That's the very important thing which you have to take into consideration. So when in doubt, don't. The homeopathic physician must be able to plan his course and once having determined upon it, to stick to it until he finds good reason for changing his course. He must be able to wait. What he is saying? Very important thing which he is explaining over there, that if he takes the case, understand the patient and makes a plan of treating the patient, he should be firm with that plan. He should not go on changing it off and on. He should every time follow the patient properly. Even in follow-ups, he must take the follow-ups clearly. Observe the remedy reaction, whether it is right, it is in the right direction or wrong direction. If it is wrong direction, then he has to think whether the potency is wrong, whether the remedy is wrong. Everything he has to take into consideration. But it is not like that every time you are going to change the remedy. It's not like that. So basically, he must be able to wait. This is very important point which he has highlighted over there. The waiting for certain period is very much necessary. The man who considers homeopathy as a possible future must be a student of people and willing to become a student of philosophy. 2 points again. He should be a student of people. What it means? And student of philosophy. What is student of people? Because you have to treat the human beings. It is the study of human beings. Homeopathy is the study of human beings. You have to understand nature of each and every human being and you have to give the remedy to that human being, not for his disease, only for the patient. So specifically, you have to learn the peoples, you have to read the peoples, you have to read the patients, and that reading you have to develop. How this will develop? This will develop only with one method, and that is You have to read the different literature, then you have to go with the people, you have to mix with the people, understand them, how the people talks, how he behaves, how he looks, what he do. Everything you have to take into consideration to understand the human nature. Then you can understand homeopathic remedy in a better manner. So first important thing, the study of a people, that is very important point. So he should be a student of people. That is first thing which he is explaining. And second, is willing to become student of philosophy. Philosophy is very much necessary. I am observing over there in all many colleges. Many colleges, there is no lecture on philosophy. In our college, we used to take the philosophy, specifically in fourth year, we used to teach all those three philosophies. And those who understand the philosophies should get a very perfect, confirmed confidence to prescribe the remedy because they have understood homeopathy in a better manner. Philosophy gives and guides you to become confident about things because philosophy explains the principles of Organon and the aphorisms of Organon in a simpler manner. By giving different illustrations, examples, it becomes rather simple to understand the Organon. And that's why one should be a student of philosophy. He must be able to read between the true and false in any symptom of the patient may give. He must possess a sense of values. True or false, in between lines. This happens many times that many patients who first, before coming to me, if they are taking someone student is taking the case, the patient gives a different history, and when he comes to me, he gives much more than that because the thing happens like that. If you are a homeopath and you have developed that quality of all those four characters which he has explained in the sixth edition of Organ of Medicine in the aphorism 83, the four qualities in order to take a good case. The first important thing, it should be freedom. There is a freedom from prejudice. Second is sound senses. Third is attention in observing. And fourth is fidelity in tracing the picture of the disease. If you have those qualities, you can read that patient and you can immediately catch that patient and you can get ample. Many times people tries to deceive you also. You should be cautious enough to catch that. No one will going to give you his bad nature, explain his bad nature. It is your duty to pursue that from the patient. And that's why he says that ability should be there to read between the true and false. That is more important. He must possess the sense of values. What is sense of values? Sense of values means exactly where one should give the weightage, which symptom he should give the weightage and which one should not give the weightage. That sense of value should be there. If patient is giving you any specific dream, you must have that knowledge that this dream, yes, this is definitely useful for you to find it out a remedy. But at the same time, if patient is giving you certain things, he is talking a lot, but he is talking everything in a general manner, you don't have to give the weightage to that. Even though he talks a lot in front of you. So he must have or he must possess the sense of value. Then he says, these are all specific entities one must know. So these are all qualities one must born. Then he says he must train himself to observe all those signs which the vital energy writes upon human face, and he must be able to interpret all signs which show through his habits and circumstances into indications for the health restoring medicines which he has at his command. Very important thing. That's why the sound senses and attention in observing this is here. He must be able to read and catch all those things which are written on the face, the countenance of the patient. If patient is sitting like this through and through, the frowning, which is very important, which you catch. You look toward the faces and faces are absolutely greasy, you catch that. There are a number of things which you can catch. The way patient sees, the way patient talks, the way patient behaves. There was one patient in the morning, and throughout the follow-ups and throughout the case taking, he talked with his eyes closed. Throughout case taking. He was a case of epilepsy. And during first consultation, even in follow-ups, whenever I asked any questions, he used to close his eyes and he used to talk. This is very important. The rubric is eyes closed, talking when. It is given in eye chapter, eyes closed, talking when. Only sepia is the remedy which is mentioned over there. So you must know all those things, and that's why he says what is written on the face that you have to catch. Hours must be spent in patient study, tracing the course of his disturbance and the remedy to fit it, always basing the process upon sound rock of natural law. What he said? If you want to spend hours together for the case, it is your duty. Because unless and until you understand that patient, you cannot treat him. Sometimes your case taking might end within first minute, but sometimes it takes hours together to understand that fellow. You have to sit with the patient, you have to discuss with the patient, you have to listen to him, you have to observe him. There are many things which you have to do. And then only you can get the thorough picture of that individual, and then you can catch the right remedy. Otherwise, it is not possible. If you have all those qualities, then homeopathy will going to give you a lot. Then homeopathy will cure those difficult disorders completely. But all those qualities should be born in in that student, and then he can choose the field of homeopathy. So some qualities we have discussed in today's session. Tomorrow we'll continue with it and we'll maintain. This chapter is very, very important for youngsters. One should not miss those chapters from the H.A.Robert. Tomorrow we're not going to meet. We're going to meet on Tuesday, not on Monday also. We're going to directly meet on Tuesday. So thank you being there and good evening. And today evening we'll learn one more small remedy from fourth year syllabus. Good evening.
Thank you very much, sir.